Hi, welcome. Today we will be talking to two people today about the healthcare system in both France and the United States. So stay tuned. Welcome, Kelly. I heard about your incident last year. Can you tell us a little bit about it?
Yes, so it was about 8 months ago, and I was at work and I fell down the stairs. On the job. So I went unconscious and my coworkers called the hospital. The doctors performed a diagnosis and the doctor said I had a concussion. I stayed in the hospital for about 4 days and the doctors cared for me until I was able to do things on my own.
How were you able to pay for the transportation to the hospital?
I was picked up in an ambulance, so transportation costs are supported if the prescription certifies that the patient's condition justifies the need of transportation. The choice of transportation has to be clearly indicated on the prescription, and the patient is obligated to travel to receive care and undergo examination or medical tests.
Can you tell me a little bit more about the healthcare system?
Sure, so the French healthcare system is a public system, funded by payroll taxes for workers and taxes, which ensures access to healthcare for all citizens. The system is primarily controlled by the state as well as nationally and regionally.
What kinds of benefits did you get from the system?
So the benefits cover medical, paramedical, and pharmacy costs, equipment, and hospitalization.
What else can you tell me in terms of insurance policies?
So the entire population must pay compulsory health insurance. The insurers are nonprofit agencies that annually participate in negotiations with the state regarding the overall funding of healthcare in France. There are 3 main funds, the largest of which covers 84% of the population, and the other 2 a further 12%. A premium is deducted from all employees' pay automatically. The 2001 Social Security Funding Act set the rates for health insurance covering the statutory health care plan at 5.25% on earning income, capital and winnings from gambling, and at 3.95% on benefits, pensions, and allowances.
Can you share with me any final opinions about the healthcare system?
Sure. So in my opinion, I feel that the healthcare here in France is much better than the healthcare in America. The doctors cared for me very well when I had my incident last year, and I feel that the healthcare is beneficial because it's universal to everyone.
Okay, well, thank you for being here with us today, Kelly. I hope you feel better.
Thank you.
Hi, Jenna.
Hi, Judy.
Welcome.
Thanks.
I was wondering if you can tell our viewers about the accident that you experienced
Yeah, of
last
course,
year.
totally. About 8 months ago, I was at work and I fell down the stairs. I went unconscious when my coworkers called the hospital. The doctor performed some diagnostics. He said I had a concussion. I stayed in the hospital for 1 day. The doctors cared for me until I was able to do things on my own.
What health insurance paid for your medical bills?
I'm actually insured through Obamacare, also known as the Affordable Care Act. It expands affordability, quality, and availability of private and public health insurance through consumer protections, regulations, subsidies, taxes, insurance exchanges, and other reforms.
What are some of the benefits of Obamacare?
Well, it offers a number of new benefits, rights, and protections. It lets young adults stay on their parents' plans until 26 years old. It stops insurance companies from denying you coverage or charging you more based on health status, or from dropping you when you are sick, or if you make an honest mistake on your application. It also prevents gender discrimination. It does away with lifetime and annual dollar limits, and it gives you the right to a rapid appeal of insurance company decisions.
That's great. Thank you. Are all Americans insured through Obamacare?
Not quite. The U.S. healthcare system is made up of many private systems, so every system is different. You also have to apply for insurance, telling them your age, if you have kids, etc. This then tells you the price of your healthcare. And it's also funded by the people's tax.
Thank you for being with us here today.
Thank you for having me.